Many people live their daily lives feeling constantly tired, sluggish, or simply not themselves. While it's easy to attribute these feelings to stress, overwork, or lack of sleep, sometimes there is a deeper, more concerning health issue at play: fatty liver disease. This condition can progress quietly, often unnoticed, until it has already caused significant harm. In this discussion, we'll explore the subtle signs that could indicate the presence of fatty liver disease and why it's crucial to recognize these symptoms early. Before we begin, don't forget to like and subscribe so you won't miss out on future videos. 1. Fatigue that doesn't go away. Fatigue is something we all experience, whether due to poor sleep, physical exertion, or emotional stress. But what if your exhaustion doesn't improve, even after a good night's sleep? This could be more than just ordinary tiredness. It might be a sign that your liver is struggling to function properly. The liver plays a crucial role in your body's energy production. One of its primary functions is to produce bile, a substance that helps break down fats into energy that your body can use. When the liver becomes overloaded with fat, in this state, the liver's ability to produce energy is impaired, leading to a constant sense of fatigue. If you're finding yourself unusually tired day after day, it might be worth considering whether your liver health is at fault. Recognizing this pattern of unexplained fatigue is important because in the early stages of fatty liver disease, lifestyle changes can make a big difference. 2. Abdominal discomfort. We've all experienced stomach pain or discomfort at some point, but when this discomfort becomes persistent, especially in the upper right side of the abdomen, it may point to something more serious. This area is home to the liver, and discomfort here could be a signal that your liver is inflamed or swollen. As the liver enlarges due to inflammation, it can press against surrounding organs, causing pain or discomfort. This type of pain often feels like a dull ache or a sense of fullness in the upper right part of the abdomen. Unlike a typical stomach ache, this discomfort doesn't go away easily and may persist for days or even weeks. If you are experiencing this kind of discomfort regularly, it's crucial not to ignore it. While the symptoms may be mild at first, liver inflammation can progress to more severe conditions such as fibrosis, scarring, or cirrhosis, permanent liver damage, if left untreated. 3. Unexplained weight gain. Weight gain is often attributed to factors like overeating, lack of exercise, or hormonal changes. However, if you notice that you're gaining weight without any significant changes to your diet or activity level, it might be time to consider whether something deeper is going on, such as fatty liver disease. Your liver plays an essential role in metabolizing fats and regulating your body's energy stores. When it becomes overwhelmed by fat, its ability to metabolize fats is impaired. This can lead to fat accumulating not only in the liver, but also throughout the body, particularly around the abdomen. This process can result in unexplained weight gain, especially if your eating and exercise habits haven't changed. 4. Skin issues, yellowing and itching. Your skin is often a reflection of your overall health, and changes in its appearance can offer important clues about what's going on inside your body. One of the more telling signs of liver dysfunction is jaundice, a condition in which the skin and the whites of the eyes take on a yellowish hue. Jaundice occurs when the liver is unable to process bilirubin, a yellow pigment produced by the breakdown of red blood cells. In a healthy liver, bilirubin is filtered out of the bloodstream and excreted through urine and stool. However, when the liver is compromised, due to fatty liver disease or other conditions, bilirubin can build up in the blood, causing the skin and eyes to turn yellow. Another skin-related symptom to watch out for is persistent itching, known as pruritus. This can occur when toxins that the liver normally filters out begin to accumulate in the bloodstream. These toxins can irritate nerve endings in the skin, leading to uncomfortable itching that doesn't seem to go away. If you notice any changes in your skin color or are dealing with unexplained itching, it's important to pay attention to these signs. They could be your body's way of alerting you to liver dysfunction. 5. Changes in urine color. The color of your urine can provide valuable insight into the health of your liver. Most of us don't pay much attention to the color of our urine unless there's a dramatic change, but even subtle shifts can be a sign of something going on with your liver. Normally, urine should be pale yellow, but if it becomes consistently dark, this could indicate a buildup of bilirubin in the bloodstream. As mentioned earlier, the liver is responsible for processing bilirubin, and when it's not functioning properly, excess bilirubin can spill over into the urine, giving it a darker color. This condition, known as bilirubinuria, is a sign that your liver isn't effectively processing waste products. 6. Swelling in the legs and ankles. Swelling in the legs and ankles is a common symptom of many health issues, from heart problems to kidney disease, but it can also be a sign of advanced fatty liver disease. This type of swelling, known as edema, occurs when fluid builds up in the tissues of the lower body. The liver plays a vital role in maintaining the body's fluid balance by producing a protein called albumin. Albumin helps keep fluid inside your blood vessels, preventing it from leaking into surrounding tissues. However, when the liver is damaged or inflamed, its production of albumin can decrease, leading to fluid leaking out of the blood vessels and causing swelling in the legs and ankles. If you notice persistent swelling in these areas, especially if it worsens over time, it's important to discuss it with your doctor. 7. Elevated blood sugar levels. Blood sugar levels are something many people monitor closely, especially those with diabetes or metabolic disorders. However, elevated blood sugar can also be a sign that your liver isn't functioning as it should. The liver is responsible for regulating blood sugar levels by storing glucose and releasing it into the bloodstream as needed. When the liver is overwhelmed by fat, as in the case of NAFLD, it can lead to insulin resistance. 8. Elevated liver enzymes. These enzymes, particularly alanine transaminase and aspartate transaminase, are normally found inside liver cells, where they help with important metabolic processes. However, when the liver is inflamed or damaged, these enzymes can leak into the bloodstream, leading to elevated levels that can be detected through blood tests. Elevated liver enzymes are often one of the first signs of NAFLD or NASH, even before other symptoms become noticeable. If your healthcare provider has ordered liver function tests and found elevated enzyme levels, it's important to take this as a warning sign that your liver may be under strain. 9. Difficulty concentrating or brain fog. Another less commonly known but verified sign of liver dysfunction, including fatty liver disease, is cognitive impairment, often referred to as brain fog. Many people with fatty liver disease report difficulty concentrating, forgetfulness, and mental fatigue, even in the absence of physical tiredness. The brain and liver are more connected than you might realize. The liver plays a vital role in detoxifying the bloodstream, removing harmful substances. When the liver is overwhelmed or damaged by fat, its ability to filter these toxins becomes compromised. As a result, these toxins can build up in the blood and eventually reach the brain, leading to cognitive difficulties. This cognitive impairment can manifest in several ways. People may have trouble focusing on tasks, find it harder to remember things, or feel mentally sluggish. It can also affect decision-making abilities and cause confusion, making daily tasks that were once simple feel mentally exhausting. 10. Loss of appetite. A lesser-known yet significant symptom of fatty liver disease is a loss of appetite. While most people associate liver problems with physical discomfort or fatigue, the liver also plays an important role in digestion. When the liver is compromised due to fatty deposits or inflammation, it can affect your body's natural hunger signals and digestion process, leading to a reduced desire to eat. Loss of appetite can occur because the liver is responsible for producing bile, which aids in the digestion of fats. This can affect the gut-brain axis, altering signals between the digestive system and the brain, which may contribute to a lack of interest in food. It's important to take this symptom seriously, especially if it persists over a period of time. Early intervention can help prevent further liver deterioration and maintain both liver function and overall health. Consulting with a healthcare provider at the onset of appetite changes could lead to early detection of liver issues, allowing for better management of the disease through dietary and lifestyle adjustments. In conclusion, fatty liver disease is a serious condition that often flies under the radar because its symptoms can be subtle or mistaken for other common issues. However, recognizing these signs, such as persistent fatigue, unexplained weight gain, skin changes, and more, can help catch the disease early. By taking action when these warning signals appear, you can protect your liver and improve your overall health. If you found this video informative, make sure to give a like, subscribe, and press the bell icon so that you won't miss out on any future videos.